Hello, this is my assessment, my HENT in cardiovascular assessment. This is my patient. Sir, can you introduce yourself?
Xavier Johnson.
How are you feeling today?
Good.
Right now, I am noting his mood and his appearance. I am also noting his skin, his tone, making sure that as I'm meeting him, I am getting an overall layout. Initially, I'm going to check his head. Checking the scalp, I'm just going to, can you remove your, sir, if you could tell me if you feel any discomfort. I'm just checking to see if there are any abrasions, any knots, and make sure he doesn't have any discomfort anywhere. I'm also going to go in between because he does have thick hair. I'm going to systematically go in between, checking to make sure that his scalp is free of any foreign matter, clean, and again, that there are no lesions or abrasions. And as I'm going around, I'm also looking at his neck and making sure that the area again has no lesions, that the color of the skin is equal all around. And that we are just thoroughly assessing his head. And it is, and his hair is okay. Sir, if you could put your hair back. While I am checking his head, I am going to do the Weber's test really quick. Sir, I'm going to ask you to note if the sensation is equal on both sides. Can you hear it, feel it equally on both sides? Perfect, that is a normal finding. Okay. As I'm inspecting his skin, I'm looking for any abrasions, any discoloration. And again, I just need you to tell me if you feel any discomfort on any areas I'm pushing on. As I am inspecting the head, I will also be checking the sinuses. And if you just tell me if you feel any discomfort.
No.
Perfect. As I was already checking his head, I was already making note of his eyebrows, their symmetry, making sure that there's no loss of hair. I'm looking at his eyelashes, make sure that they're nice and full on both sides. I'm going to ask you to look up at me. I'm looking at his sclera, making sure that it's nice and white. I'm looking at his pupils. There's no jaundice. His conjunctiva is nice and pink. While we are looking at his eye, I am going to be looking. Open your eyes wide, please. Open wide. Into the retina. Focus straight. Making sure that I can see the optic disc. Open. Look straight, please. Perfect. While I'm checking out his eyes, I'm going to check out his perla, his pupillary reaction. You can look at the light, and I'm going to literally look for it coming on each side I'm making sure that the disc, I'm making sure that his pupils dilate and constrict equally on both sides. And I'm going to do the same on the opposite side. Keep your eyes open. Making sure that they both constrict equally. I was already noting the size of his pupils. They do appear to be 3, which is within normal, 3 milliliters, which is millimeters, which is normal. I'm going to check to make sure that he has good peripheral and extraocular movements. I'm going to ask you to just follow the pen. I'm just noting to make sure there's no nystagmus, that the eyes are equal, and that there's no abnormalities noted. So I have checked his eyes out. Continuing down, I'm going to check his nose. I'm making sure that there's no pain, that it's symmetrical. I've already checked his sinuses. His sinuses are clear, his nasal passages are clear and pink. I've checked his eyes, I've checked his nose. We can come down to the mouth. His lips are symmetrical, nice and pink. They're not dry or chapped. I'm going to ask you to open your mouth wide. Ah. Lift your tongue to the roof of your mouth. Looking under the tongue. Stick your tongue out. Say ah. Checking out the palate. Checking to make sure that its oral mucosa is nice and pink. Okay, stick your tongue out, please. And I'm going to ask you to move your tongue to the left. Stick your tongue out, move it to the left, to the right, and then lift it up and down. And what I'm making sure is that cranial nerve 12 is intact. That is oral. I have inspected the tonsils, his teeth. There was no abnormal odor. I do need to check your sense of smell. You can close your eyes for me. Once his eyes are closed, I'm going to introduce a smell and ask him to identify it.
Vanilla.
And he is correct, it is vanilla extract. His sense of smell is intact. Next on the head would be the ears. I have already inspected, and now I'm going to palpate, make sure there is no pain or discomfort. Sir, if you can tell me if you have any pain. I'm checking the targus, outer ear, again looking behind the ear, making sure there's no abrasions. And again, the opposite side, checking the targus, any discomfort?
No.
Really doing my best to make sure that I'm being thorough. I am going to check his tympanic membrane. It is nice and pearly and gray. I can see the light reflected. I'm gonna actually turn your head just a little bit. Again, I pull up on the outer ear and up and out. Just making sure I can see that pearly gray tympanic membrane and that the light is reflected at 5 and 7. Okay. Going down, I'm going to inspect the neck. I have already looked to make sure that I am inspecting and the skin is intact. Shake it is symmetrical, neck is symmetrical, and now I am going to palpate, going behind him. I'm going to palpate his thyroid. I'm going to have you repeat after me. No, I'm going to have you, I'm sorry, can you swallow for me? And perfect. And while I'm here, I'm just going to check his carotid pulse. +2 bounding. +2 bounding. As well as his temporal. +2 bounding. Okay. I'm going to check his temporal artery and his carotid artery. And here I would be making note if a buoy was auscultated. Can you lift your head and turn a little bit? In the opposite way. Within defined limits. Alright. I'm now going to be checking for his cranial muscle 10, 11. Sir, shrug your shoulders. And push down. Okay. Push against, turn your cheek against my hand as hard as you can. Good. Opposite direction. Perfect. While I'm here, I'm going to have you open and close. No clicking, no popping. And since I am in the position of palpating, I'm also going to palpate any sinuses. Tell me if you have any discomfort. Maxillary. Any discomfort? No. Okay. And since I am palpating at this point, I would also palpate limbs. So we'll start with posterior auricular, anterior auricular, and I'm literally just feeling for the lymph nodes. Submandibular, submental, anterior cervical, posterior cervical, answer. His lymphoids are normal. I'm going to start listening. I have already inspected, I have palpated. I am going to do a check his auscultation. Take a deep breath. Out. Well, let's go from this clavicle. Go down 1, 2. I just switched gears to do my cardiac assessment, and then I'm going to do my lung assessment in the front and back. So this was the atrial, the aorta, mitral, nerves, the aortic pulmonary, herbs, tricuspid, and mitral. So I noted S1 and 2 audible with no abnormal sounds. And now I'm going to check his lung sounds, which would be checked. Sorry, keep your hands down. Going around bilaterally on each side, and then following the same pattern on the back. And I'm just going to have you take a deep breath in. Sorry, inhale. Out. Inhale. Out. Inhale. Out. Inhale. 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 Out. Out. Going to the back. Again, taking care not to go over the scapula. You want to be up here. Take a deep breath in. Again. Okay. Alright. I am going to check his not what I missed. I'll check his tactile firmness. I'm gonna have the patient repeat after me. Sir, say 99.
99.
I'm sorry, say one more time.
99.
A little louder?
99.
Perfect. Yes, that's pretty good. I've checked his respirations are nice and equal. His thoracic cavity is symmetrical with symmetrical expansion. The skin is intact. I have auscultated lung sounds in all lobes, as well as the cardiac, aortic, mitral, tricuspid, and pulmonary valves. And I'm just going to have him look up, and I'm just going to I'm just looking for jugular vein distension. Oh. this check. Sit up. Now the popliteal arteries.